Hello, I'm Dr. Thomas Richard, and welcome to my YouTube channel. On this channel, I provide accurate, evidence-based medical information and practical health guidance designed to help you better understand your health and make informed healthcare decisions with confidence. If you value credible health information, please subscribe to the channel, turn on notifications by clicking the bell icon, and like and share this video. Your support helps expand access to reliable medical education for people everywhere. There's a tiny thing many people over 60 do in the dark, almost without thinking. And it may be pushing their blood pressure higher at the exact time their heart is supposed to be recovering. I'm not talking about a salty dinner. I'm not talking about forgetting a pill. I'm talking about a bedtime habit so brief, so ordinary that most seniors would never imagine it could affect what happens inside their arteries for the next 6 to 8 hours. And yet, I've seen this one habit quietly contribute to higher morning readings, restless nights, pounding headaches, medication confusion, and a kind of exhaustion people keep blaming on age. Some of the blood pressure problems that look mysterious during the day begin with what happens in the last minute before sleep. Not always, not for everyone, but often enough that if you're 70, 75, 80, or caring for someone who is, you need to hear this entire video before tonight. Because the habit I'm going to show you takes about 30 seconds to start and can keep your nervous system stirred up long after your bedroom goes quiet. If this video helps you protect your heart tonight, please subscribe, tap the bell, and join our community for calm guidance. Now, the habit itself may surprise you because it doesn't feel dramatic. It feels harmless, it feels modern, it feels efficient. And that's exactly why it slips past people. The habit is this: reaching for your phone after you've already gotten into bed for one last check, one last text, one last weather update, one last look at the news, one last scroll, one last glance at tomorrow's calendar. Just 30 seconds, maybe a minute, and that one tiny choice can trigger a chain reaction that delays sleep, lightens sleep, fragments sleep, and in some people raises the odds that blood pressure stays higher when it should be dipping lower. Let me tell you about Lorraine from Ohio, age 78, because her story captures this better than any chart ever could. And it begins exactly the way these stories usually begin. Lorraine was disciplined. She took her medications on time. She limited salt. She walked every afternoon in her hallway when the weather was bad. She checked her blood pressure most mornings and wrote the numbers in a notebook. But over 4 months, her readings began creeping up. Not into terrifying crisis range, just enough to create worry. 128 became 138, then 142. Then the occasional 148. Her doctor wondered if she needed more medication. Lorraine kept saying, "I'm not doing anything differently," but she was. Every night after climbing into bed, she reached for her phone. At first, it was just to see if her granddaughter had texted. Then it became the weather for tomorrow, then local headlines, then a short video, then an article about cholesterol, then an ad that led to another article, then something upsetting about crime in a nearby town. Lorraine insisted she was only on the phone for a minute or two, but when we looked closely at her routine, that minute or two was often 15 or 20. And even on nights when it truly was short, those last moments before sleep weren't neutral. Her brain was being activated, her attention was being hooked, her breathing pattern changed, her body stopped drifting toward sleep and shifted back toward alertness. This is the first thing most people miss. The damage isn't only about the length of time, it's about timing. Your body has a built-in transition into sleep. Heart rate eases down, muscles soften, stress chemistry begins to quiet. Blood pressure, in a healthy pattern, usually drops at night. Doctors call that nighttime dipping. That drop matters more than most people realize because your heart and blood vessels are supposed to get a period of relative relief while you sleep. When that dipping is reduced or when sleep becomes shorter and lighter, the cardiovascular system may stay under more pressure than it should. And after 60, that matters even more because aging changes sleep architecture whether we like it or not. Many older adults spend less time in deep restorative sleep. They wake more easily. They are more sensitive to pain, noise, temperature, bladder signals, medication timing, and anxiety. So when a younger person does something unwise before bed, they may get away with it for a while. An older adult often doesn't get away with it. The system is less forgiving. The margin is smaller. A little more stimulation at night can have a much bigger effect by morning, especially if blood pressure is already borderline or being treated. Let me explain what that phone check does in plain language, because once you understand the mechanism, you will never see that bedtime ritual the same way again. First, there's mental activation. The human brain doesn't interpret every phone glance as harmless. It interprets it as possible information, possible urgency, possible reward, possible threat. A message could be good news, bad news, a bill reminder, a medical portal alert, an upsetting headline, a family problem, or just enough novelty to wake the brain up. Even before you consciously react, your nervous system is leaning forward. You are not settling, you are bracing just a little. And in cardiology, a little often matters. Then there is the emotional layer. And this is where things become especially important for seniors who live alone or worry at night. A phone is not simply a screen, it is a delivery system for surprise. You may open it expecting the weather and find a story about a celebrity's sudden death. You may check tomorrow's appointments and remember an unpaid bill. You may see a family photo and suddenly feel lonely. You may read a political headline and become irritated. None of this has to be extreme to matter. Blood pressure responds to shifts in arousal. Mild mental stress, especially at bedtime, can keep the body from making the calm transition it needs. Now add the third factor, sleep delay. This is the trap almost everyone falls into, because it never feels like delay while it's happening. People say, I only looked for a second. But the phone is designed to stretch seconds into minutes. One notification becomes 3. One article leads to another. One search becomes a thread. And even if you put the device down quickly, you may not fall asleep as quickly as you would have without that stimulation. That means less total sleep, later sleep onset, and often lighter sleep. When this happens night after night, the blood pressure effect isn't always dramatic at first. It accumulates quietly. I want to pause here because some of you are thinking, Doctor, I don't doom scroll, I just check the time. And that's a fair objection. But the body doesn't always distinguish your intention from the effect. If the phone brightens your eyes, pulls your focus, reminds you of tomorrow, or leads to even one extra loop of thought, it may still interfere with the descent into sleep. And if you already struggle with insomnia, nighttime worry, frequent waking, sleep apnea, or early morning surges in blood pressure, that tiny interruption may be enough to matter more than you think. Let me tell you about Harold from Arizona, 82 years old, because his case exposed a pattern I see over and over, especially in men who insist they are just checking one thing. Harold kept his phone on the nightstand to look at overnight market futures before sleep. He was retired, but he still followed the numbers every evening as if he had to make a trade at dawn. He'd say it relaxed him. But his wife told a different story. She said every time he looked, his face tightened. Sometimes he muttered, sometimes he took a deeper breath and stared at the ceiling afterward. Sometimes he rolled over twice before settling. His morning blood pressure was consistently higher after those nights. When Harold stopped the bedtime check for 10 days, something interesting happened. He didn't become a different person overnight. He didn't suddenly sleep like he was 25, but his sleep onset improved. He woke less agitated. His morning readings became more consistent. The dramatic highs became less common. Was the phone the only factor? No. He also had mild sleep apnea and too much coffee before noon, but the bedtime screen check was one of the last things keeping his brain half on duty. And once it was removed, his cardiovascular system finally got a better chance to settle into the pattern we wanted. Here is the deeper truth people miss. Blood pressure is not only about what happens when you're awake, it is also about what your body fails to do when it should be asleep. A healthy night is not passive, it is active recovery. During good sleep, blood vessels, hormones, heart rhythm, breathing patterns, and nervous system balance all move in a coordinated direction. When that process is disturbed repeatedly, the cost may show up as higher readings, worse morning surges, more fatigue, poorer concentration, and greater strain on the heart over time. So the question is not, did my phone raise my blood pressure this second? The real question is, did my bedtime habit interfere with the night my body needed? And there is strong reason to take that question seriously after 60. Research over the years has shown something that should make every senior sit up and listen. Because it certainly got my attention. Older adults are more vulnerable than younger adults to the blood pressure effects of sleep loss. In other words, when sleep gets disrupted, delayed, or reduced, seniors may show a bigger blood pressure response than younger people do. That helps explain why some older adults say, I only slept badly one night and my pressure was up the next morning. They're not imagining it. Their system may actually be more reactive. Now let's talk about why the final minutes before bed are so powerful. Most people focus on daytime triggers: salty foods, stress, missed medication, pain, dehydration, lack of exercise. All of those matter, absolutely. But the brain is especially impressionable in the transition period before sleep. What you feed it there tends to echo into the first part of the night. If you feed it stillness, darkness, routine, and safety, sleep has a fighting chance. If you feed it alerts, argument, novelty, planning, and light, you are asking a 70-year-old nervous system to slam on the brakes and the gas at the same time. I saw this clearly with Diane from North Carolina, age 74, whose story still stays with me because she did almost everything right. Diane limited sodium. She kept her weight down. She took an evening walk with her neighbor. She went to bed at a reasonable hour, yet she woke with headaches 3 mornings a week and had no idea why. When I asked about bedtime, she laughed and said, "Nothing unusual. I just check my medical portal before sleeping in case any lab results came in." That one sentence told me everything. Imagine putting your nervous system on alert for test results right before trying to sleep. That's not bedtime. That's a pre-alarm. Diane wasn't even getting terrible news. Most nights there was nothing important there. But her body didn't know that in advance. Anticipation itself was enough. She lay down wondering whether something new had arrived. Her mind reviewed old appointments. She replayed conversations. Her sleep became shallower, and on the night she woke up to use the bathroom, she checked the phone again. That second nighttime check was sometimes even more disruptive than the first, because now she was breaking a fragile sleep cycle and throwing more stimulation into a brain that needed darkness and quiet. Once she set a rule that the portal could not be opened after dinner, her mornings improved within weeks. And that brings us to a mistake families make all the time. They assume that if a habit looks calm, it is calm. Watching a phone in bed looks calm. Lying still looks calm. Reading headlines silently looks calm. But inside the body, calm is not defined by the absence of movement. Calm is defined by physiology. Is the nervous system deactivating? Is the heart rate easing? Is the breathing becoming slower and more regular? Is the brain shifting towards sleep? A person can be perfectly still while their internal alert system is being nudged upward by what they are seeing, thinking, anticipating, or fearing. Some of you may be wondering whether the real villain is the light from the screen or the content on the screen, and the answer is, for many older adults, it's both, plus the habit loop itself. The light can signal wakefulness when the body is trying to prepare for darkness. The content can provoke emotion or thought, and the habit teaches the brain that bed is not only for sleep, bed is for checking, monitoring, reacting, planning, and staying available. Once that association gets strong, insomnia often becomes easier to trigger. Then poor sleep leads to higher morning pressure, more worry about health, more nighttime checking, and the whole thing becomes a circle. Let me say something important here for anyone whose blood pressure has been mysteriously harder to control. Not every stubborn reading means you need another medication, and not every medication problem is actually a medication problem. Sometimes the issue is measurement timing. Sometimes it's untreated sleep apnea. Sometimes it's pain. Sometimes it's alcohol. And sometimes it's a sleep-disrupting routine that keeps robbing the body of the nighttime reset it needs. If your numbers rise gradually, if mornings are worse than evenings, if sleep feels thinner than it used to, and if the phone is the last thing your brain sees every night, that is not a detail to dismiss. I remember Victor from Florida, 80, who had been convinced his medication had stopped working. He said his pressure had become unpredictable, especially in the mornings, and he wanted something stronger. But when we broke down his actual evenings, we discovered a pattern. He got into bed at 10 o'clock, then checked sports scores, then read comments, then watched 2 or 3 short clips because the phone was already in his hand. He insisted it helped him unwind. Yet he also admitted he often felt oddly awake afterward. That phrase, oddly awake, is exactly how many people describe stimulation they don't recognize as stimulation. It doesn't feel like panic, it feels like sleep refusal. Victor agreed to a simple experiment. No phone for 1 hour before bed, not forever, just 1 week. He thought nothing would change. But by day 4, he noticed he was falling asleep faster. By day 6, he woke less groggy. By the end of the week, his morning readings had not become magically perfect, but they were steadier. The spikes were softer. He felt less driven to check his blood pressure twice before breakfast. That matters because when people see one high morning number, they often trigger a second cycle of anxiety that raises it further. Better sleep doesn't solve every blood pressure issue, but it often removes one layer of chaos. Now I need to talk directly to caregivers, sons, daughters, spouses, and grandkids because sometimes you are the only ones who can spot this pattern. If you notice that the person you love brings the phone into bed every night, sleeps lightly, wakes tired, complains of morning pressure, or says things like, "I just need to check one message," do not brush it off as stubbornness or boredom, because it may be a true health factor. Many older adults do not realize bedtime device use affects them as much as it does. In fact, a surprising number underestimate the connection entirely. They think poor sleep is simply part of aging. It isn't always. And nighttime awakenings deserve their own warning, because this is where many seniors unknowingly sabotage themselves. They wake at 1:30 to use the bathroom. On the way back to bed, they think, "Let me just see the time." The time is on the phone. Then they see a notification. Then their mind wakes up again. Now their blood pressure may not suddenly leap into dangerous territory in that exact second, but their sleep cycle has been interrupted, their alertness has been rekindled, and the chances of a long, restless stretch have gone up. Do that repeatedly, and the cardiovascular cost is no longer theoretical. It becomes practical. So, what should you do tonight if this sounds uncomfortably familiar? The first step is not guilt. The first step is recognition. You are not weak, foolish, or lazy if you develop this habit, because the devices were built to capture attention and reward repetition. The goal is not shame. The goal is to protect the most medically important part of your day, the part when your body is trying to heal. If you can preserve that window, you improve far more than sleep. You improve the environment in which blood pressure regulation is supposed to happen. Here's the protocol I want you to think about as your heart-protective bedtime reset. And I want you to picture it clearly, because details matter. 1 hour before bed, the phone leaves your hand. 30 minutes before bed, it leaves your bedside area entirely. If you need it for emergencies, place it across the room on silent, except for specific family contacts. If you use it as an alarm, fine, but do not let the alarm clock function smuggle the rest of the internet into your pillow space. Bed should not be a command center. For older adults with blood pressure concerns, the bedroom needs to become boring again. Replace the last phone check with a 30-second habit that helps instead of harms. This matters because habits cannot simply be removed. They are easier to replace. Sit on the edge of the bed, place one hand on your chest and one on your abdomen, and take 3 slow breaths. Not dramatic breaths, not performance breathing, just slow enough that your exhale is a little longer than your inhale. Then say, either out loud or silently, "Nothing else needs me tonight." That sentence sounds small, but for many older adults, it breaks the illusion that vigilance equals safety. At bedtime, hypervigilance usually steals the very recovery you need. If breathing isn't your style, use a simple paper routine instead, especially if you are someone who reaches for the phone to check tomorrow's plans. Keep a small notepad by the bed. Before you enter the bedroom, write down tomorrow's most important appointment, one task, and one thing you can safely ignore until morning. Then close the notebook. Once it's on paper, the brain feels less pressure to rehearse it. What you do not want is to outsource bedtime reassurance to a device designed to tempt you into stimulation. Now let me tell you about Martha from Tennessee, 77, because her turnaround was one of the most encouraging I've seen, and it came from a shockingly small change. Martha had developed the habit of taking her phone into bed specifically because she said silence made her anxious. She would read cheerful stories, then family posts, then recipe videos until her eyes got heavy, but her sleep stayed light and her morning pressure remained stubbornly elevated. Rather than telling her to just stop, we replaced the phone with a lamp, a devotional booklet, and a paper list of emergency contacts so she wouldn't fear being unreachable. Within 2 weeks, bedtime felt safer to her without the screen. And when bedtime felt safer, sleep deepened. That word safe is important because for many people over 70, the phone at night is not really about entertainment. It is about reassurance. Reassurance that the family can reach them. Reassurance that they won't miss something urgent. reassurance that tomorrow is under control. But ironically, the search for reassurance often becomes the very thing that keeps the body from settling. The heart does not recover well in an atmosphere of constant readiness. And if your blood pressure already runs high, your nighttime routine cannot keep whispering to your nervous system, "Stay on alert, something may happen." Let's also talk about what not to do with this information. Do not stop your blood pressure medication just because you think the phone may be part of the problem, and do not assume every high reading can be fixed with better sleep. That would be dangerous. Hypertension is real. Stroke risk is real. Heart failure is real. What I'm saying is that bedtime stimulation may be one overlooked contributor, and if you remove it, you give your treatment plan a better chance to work. This is not an either or. It is not pills versus habits. It is pills and habits, measurement and sleep, medical care, and daily routine working together. If you want to prove this to yourself instead of just believing me, do a 7-night experiment, because nothing changes behavior faster than evidence people can feel in their own body. For 7 nights, no phone in bed. Keep everything else as stable as possible. Take your blood pressure the same way each morning. Write down how long it took to fall asleep, how many times you woke up, and how you felt when you opened your eyes. Not perfect scientific data, but useful data. Then compare those mornings to the week before. You may not see miracles, but if your sleep latency improves, if your mind feels quieter, if your morning readings become less erratic, you've learned something important. And if nothing changes, that's useful too, because it tells you to keep looking. Maybe the bigger issue is sleep apnea. Maybe it's pain waking you up. Maybe it's late evening alcohol. Maybe it's nighttime urination from medication timing. Maybe it's a mattress problem, reflux, depression, or untreated anxiety. The point is not to blame the phone for everything. The point is to stop ignoring a common bedtime trigger simply because it looks innocent. Cardiovascular medicine is full of innocent-looking habits that turn out not to be so innocent. There is another reason I care so much about this subject, and it has nothing to do with technology itself. It has to do with dignity. Too many seniors are told that poor sleep, morning headaches, tiredness, brain fog, and changing blood pressure are just what happens when you get older. I reject that lazy explanation. Yes, aging changes the body. But no, that does not mean we stop examining patterns. Sometimes the answer is not age, sometimes it is routine, sometimes it is environment, sometimes it is a behavior so small no one thought to ask about it. And when you find it, the relief people feel is enormous because they realize they are not helpless. Now I want to address a very specific group watching this. People who say, "My phone helps me fall asleep because I get sleepy while scrolling." Please hear me carefully, because this is one of the most deceptive experiences in modern sleep health. Feeling drowsy while scrolling is not the same as building healthy sleep. You may be tiring your eyes while activating your brain. You may be sedating your attention while delaying deeper physiological wind down. That's why some people can barely keep their eyes open with the phone in their hand, yet the moment they put it down, their mind starts racing. The body was not truly ready. It was distracted, not restored. This also explains why some older adults wake up feeling as if they slept all night but never feel refreshed. Because quantity and quality are not the same. If sleep is shallow, fragmented, delayed, or repeatedly interrupted by screen checks, the night may not deliver the cardiovascular benefit you need. Good sleep is not merely being unconscious for several hours. Good sleep is organized recovery, and blood pressure responds not only to whether you slept, but to how well that sleep allowed the body to complete its normal overnight work. Before we finish, I need to tell you when this becomes urgent. If you are having very high blood pressure readings, chest pain, shortness of breath, weakness on one side, trouble speaking, severe headache unlike usual, or confusion, do not sit there blaming your phone. Seek medical care immediately. A bedtime habit can contribute to hypertension patterns, but it is not an excuse to ignore emergency signs. Likewise, if your blood pressure remains elevated despite good habits, consistent medication use, and improved sleep, talk with your doctor. You may need adjustment, testing, or evaluation for sleep apnea or another condition. So, if you are over 60, over 70, over 80, and your blood pressure has been frustrating, inconsistent, or mysteriously higher in the mornings, do not overlook the last 30 seconds of your night. They may not be the only reason, but they may be one of the easiest reasons to change. Tonight, protect your sleep like it is part of your treatment, because in many cases it is. Put the phone out of bed. Let your nervous system feel off duty. Let your heart have the quiet it has been asking for, and I'll see you in the next video.